Hi friends, this is Shri Vidya. I welcome you all to my channel on Cardiac Essentials. Like we were discussing before, so what is the connection between diabetes, heart disease, and stroke? So when we are talking about high blood glucose levels from diabetes, so high blood glucose levels can have a major impact, negative impact on the blood vessels and nerves that control the heart and blood vessels. So what happens with time, like time passing by, that damage can lead to heart diseases. So if you are diabetic, that means you have more chances of developing a heart disease at a very younger age than people without diabetes. So how do you what steps do you take to you know lower the chances of a heart attack or stroke? So manage your diabetes of ABCs. Knowing your diabetic ABCs can in a great way help you manage your blood glucose, blood pressure, and cholesterol. And if you have the habit of smoking, no puffs, because smoking and diabetes, they don't get along together. So you might be asking, Shri, what is this ABCs? A is for A1C test. So A1C test shows you the average blood glucose level over the past 3 months. So which is different from the blood glucose checks you do every day, The higher your A1C number, the higher your blood glucose levels during the past 3 months. So high levels of blood glucose level means greater harm to your heart, blood vessels, kidney, feet, and eyes. So A1C goal for many people with diabetes is below 7%. So some people may do better with a slightly higher A1C goal, but 6.4 is good, but 7% is okay. So your A1C goals may also change as you get older, and your lifestyle changes. So you have to consult your diabetologist with the age factor you are in, that should be the thing. And what is a B is for the blood pressure. And what is blood pressure? Blood pressure is the force of your blood against the wall of your blood vessels. So if your blood pressure is too high, what will it do? It will make your heart work too hard to pump blood. So what happens eventually? The high blood pressure causes a heart attack or leads to stroke or damage to your kidneys and also to the vision. With diabetes, the vision that can also lead to blindness. So diabetes is like you will have to take care of it, keep a check on it, like they say checkmate. You have to do a checkmate with diabetes. It's too harmful. And within a jiffy of moment, the blood sugar level increases. You have to be really maintaining it. So the blood pressure goal for most people with diabetes is below systole by diastole 140 by 90 mmHg. So again, it depends on the present condition of what you are, because I don't know your current physiology. So I'm just talking in common terms, but you will have to consult your physician before you get on to because I don't know your history. And what is C? C is for cholesterol, buildup of cholesterol. What is cholesterol? Is a form of fatty substance found in your blood, which can lead to heart attack or stroke. So if you are over 40 years old, you need to take medications. Like I said, statins, don't get intimidated. Statins are really not bad, or they will not damage your liver. You'll have to talk to your doctor. Crestar 5 mg is good for a start with. So also to lower your cholesterol levels, protect your heart. And many of the patients who have very high LDL, bad cholesterol, may also start taking medicine at a very young age. So you might be asking, how do I learn about getting your cholesterol checked? So we'll be talking about it. S is for stop smoking, ABCs. Then S is for stop smoking. Quitting smoking is especially important for people with diabetes, because smoking and diabetes, they narrow the blood vessels. Puff, puff, puff sits on the artery. So your heart has to work harder. And people nowadays, they switch on to e-cigarettes, E-cigarettes aren't a safe option either. They just say it's okay. So if you quit smoking, you can lower your risk for heart attack, stroke, nerve, kidney, vision, even turning blind or amputations. But diabetes can lead to soreness, and even feet or leg it will result in, finally, if it is beyond the medical grounds, to correct it. If it is too late, then amputation is the only option doctors have. So don't take diabetes easily. I'm not trying to intimidate you, but diabetes and heart disease they have direct impact. Diabetes has got direct and very highly risk factor for moving to heart disease. Like, it has a very bad impact on the heart. Your blood sugar, blood glucose levels, blood pressure, cholesterol levels may improve if you quit smoking. Blood circulation will improve, and you will have an easier time being physically active. How many of you, we all feel like, okay, why don't we be active? I'm not able to do good. Oh my gosh, I get up in the morning, I want to lie down. And smoking and tobacco products are really, really bad. They narrow the arteries, Some people have zarda pan, they keep it on the cheek, man. It's so bad. In spite of telling them, they say it's hard to quit. Take a psychologist's help, You need not take tablets, but psychologists are very good. I'm not talking about psychiatrist. You can go to a psychologist. There is a difference. You can go for sessions. You can go for counseling. They can talk out and they can help you, What is our brain? It just observes what we see. Life is a window with what we think and what we see. That's all we get. Every individual. So you should talk to your doctor, a diabetologist, about your A1C levels. What is my goal for A1C? 7%. How do I bring it down? So eventually you'll be controlling your blood pressure and cholesterol. And, there are self-management skills, registered dietitians, those who are registered, board certified dietitians, or that don't go for some hospitals, like they just take a novice and just appoint them. Don't go in for such dietitians. They cannot give you a good diet chart. Untrained dietitians cannot give you good diet charts. They have to be registered dietitian, approved by some insurances also cover dietitians. Also some private insurers or some organizations are there. They can also provide you with dietitians. They'll say, okay, you go to that dietitian, it will be covered. Go to them, have a nice diet chart, but ensure that they are registered dietitian, not some Tom, Dick and Harry. Don't go, because not worth. You have something, I'm eating something will not, can quench my hunger, but will not be, I don't know whether it will be healthy for my body. But you definitely need something that is nutritious, high value, high nutritional value, plus that can, give a good satisfaction to your tummy, hunger. So such is the role of a registered dietitian. So I have a very good friend who doesn't live here, she's in North, but awesome dietitian who can really derive at a good diet charts. She's a registered dietitian, and she was in Delhi before, now she is in Nagpur. So now let me talk. You can keep track of your ABCs with a diabetes record, with a normal diabetes record, and then you can have a notebook. Nowadays even journals are available like in bookstores where you can record your diabetes. Okay, I'm going to do that. You can do it. Or you take a simple notebook. You can daily take what your, simple thing like what is your diabetes levels. I mean, I'm not asking you to do it every day, but you can still keep a track of it. Postprandial, fasting blood sugar, and when you are meeting your healthcare provider, you can show it. It will be easier for them. If you are keeping a diabetic record, you are making things for the diabetologist much easier rather than them coming and telling, okay, you know what, go do your fasting blood sugar, postprandial blood sugar, observe yourself, for 2-3 days, then come, let's monitor. Remotely at your home itself, it's easy. Nowadays, you have so many gadgets, even you have so many things that you need not even do a prickless diabetic apparatus are there, where you don't have to every day prick yourself. You can just follow that, and non-prick diabetic apparatus are there that you can buy, and you can still monitor your blood glucose levels. Like you have this, smart glucose monitor is there. Smart glucose monitor, which is real time. And then you have this AGEC CGM, sensor only glucose monitor. So there are many non-invasive, lightweight, portable blood glucose levels, and some you can have the reading on your, your phone itself. You don't have to really get on with what will I do. You on your phone itself, you will be getting the reading. Just click on that, and without pricking, you have glucometers like a freestyle Libre. Without pricking, you can 2+ sensor. You can still keep reading, and so there are a lot in the market about the glucose levels. They say without pricking, but still we have to do that. Like it majorly, I use like the Contour Plus. I don't go in with the non-prick ones because I'm not used to it so far. So one thing is the accuracy of a non-invasive home glucose monitor. So 95% of the meter reading should be within plus or minus 15% of the reference reading, and 99% of the reading should be within plus or minus 20%. So that's how you have to calculate your blood glucose levels. So with this, I'm going to end up my video on diabetes and heart disease. So if you like my video, do put a like, and stay tuned, subscribe to my videos for the upcoming ones. Wishing you all a very healthy lifestyle. Thank you and God bless.